Good afternoon, everyone. Welcome back from lunch. We are getting ready for our third session of the Texas State of Enrollment Conference. As you have been here for our previous two sessions, we will be starting with interpretation services. And so we must ensure that everyone is in the right language channel. And so with that, I will be passing it to my colleague, Azucena. And if we could also get the slide deck up and being shared for the instructions to choose your channel. Thank you so much.
Thank you. Can we start the interpretation, please, with Vic and Q? Thank you. So good afternoon and welcome. We're going to be offering simultaneous interpretation into Spanish and Vietnamese. And next slide, please. For those of you that want to use this service, please go to the bottom. Next slide, please. Go to the bottom of your Zoom screen. If you are joining us from a computer, you will see at the bottom of your Zoom screen a globe that says interpretation. And if you click on it, you will be able to make your language selection. Next slide, please. If you are joining us from a mobile device, like a cell phone or a tablet, please look for the three dots that say more. And there you will be able to access the language interpretation menu, make your language selection, and then click done when you're ready. And I'm going to ask my colleague Vic to go to the English channel briefly, just do a quick test. Those of you in that channel should be able to hear him. If you don't, please let us know. And now I'm going to give, thank you. Now I'm going to give instructions in Spanish. Buenas tardes, bienvenidos. Esta tarde vamos a ofrecer interpretación al vietnamita y al español. Y los que necesiten este servicio, next slide, please. Yeah, thank you. Por favor, si están conectados desde su computadora, pueden ver en la parte de abajo que hay un globito que dice interpretación. Si hacen clic ahí, pueden elegir su idioma de preferencia. Si nos están acompañando desde un celular o una tableta, por favor busquen los tres puntitos que dicen más. Ahí pueden tener acceso a un menú que va a incluir interpretación de idiomas. Y ahí pueden hacer su elección de idioma y nada más recuerden hacer clic en listo o done para que funcione la interpretación. Le voy a pedir a mi colega Vic que por favor vaya brevemente al canal de español. Las personas que estén en ese canal, si no lo escuchan, por favor díganos en el chat para poderlos ayudar. Perfect. Thank you.
Next slide.
Thank you. Yes, thank you.
Kính thưa quý vị biết rằng là có hỗ trợ phiên dịch cho cái buổi họp ngày hôm nay. Nếu quý vị dùng máy tính á, thì quý vị bước 1 á, ở bên góc phải quý vị bấm vào cái quả địa cầu. Bước 2 quý vị bấm vào cái chọn ngôn ngữ bằng muốt, ở đây là tiếng Việt Nam. Và cái thứ ba là bên góc phải đó, quý vị bấm giúp cái chữ Vietnamese là tiếng Việt Nam đó.
Thank you. Can we please, we made interpreters. Oh, yeah.
Is Koi still going through? And are you good, Koi? Perfect. All right, everyone. Thank you so much for selecting your language channel. As a reminder, if you are in the Zoom lobby, if you would like interpretation services in English or Vietnamese, you want to make sure that you're moving into the lobby. In addition, for folks that are still in the lobby, you can stay there. We are monitoring the chat, but if you would like to come in and use the Q&A function and or take the poll at the end of today's webinar, just know that we have to be in this space. And by the space, I mean the webinar space. And again, thank you to our interpretation team for making today's event accessible. Also, thank you to the St. David's Foundation for their generous support in ensuring that we have language access today. And with that, I will, apologies. Here is the agenda for the TSOE. This is our third session of the day. All of times are in Central Time. We have one more session after this one, and then we'll begin again tomorrow morning. If you have any questions, please make sure you are using the chat box or the Q&A function. And with that, I will be passing it over to my colleague, Lynn, to get us started. Thank you so much.
Thank you, Katie. Yeah, this is a jam-packed session, so I'm just going to overview real quick what we'll talk about in general. Thank you so much to our speakers, to conference organizers Katie and Simona from Every Texan, to our translators, to our funders, and really just to everybody for being here. This is just such an important time of year, and we've just got a lot to learn from each other and a lot of work to do moving forward. So I'm just like really happy to share this space with y'all. So this session here, state legislative overview and policy changes, effects on Texas enrollment and utilization for HHS and marketplace programs, is a mouthful. We will talk about state-based programs and a little bit about federal programs today. Thanks, Blake, for bringing in the perspective on enhanced tax credits also. So we've got a few learning objectives for today. We want to make sure that participants are aware of new Texas laws that were passed in our most recent legislative session, how that will affect people's access to healthcare and food programs. We want to make sure also that participants have information that they need to update applicants who are enrolling in programs moving forward during the open enrollment period for marketplace health insurance and also for HHS programs throughout the year, like Medicaid, the Children's Health Insurance Program, and SNAP food stamps. We also want to make sure that folks who are assisting people enrolling in marketplace health plans understand how some of the changes to tax credit availability may affect prices. Ariana in our last session just did a really amazing job talking about how to explain some of those changes to to people who are applying. And this will just give a little bit more context for that conversation, or for those talking points for community members. And yeah, this session will, like others, kind of like complement one another. So if you missed any of those, we'll be sure to review here. And all these recordings will be available after the conference as well. All right, so with those learning objectives in mind, I just want to remind folks to stay until the end of the session if you want to participate in the poll for the chance to win a $50 gift card. And then we will have some time for Q&A at the end of this session. So we'll go ahead and get started. I'm going to give our first kind of overview of the Texas State Legislature. I'll introduce speakers from the Health and Human Services Commission, Texas Association of Health Plans, my colleague Amber O'Connor moving forward, and the Coalition of Texans with Disabilities. But we'll just start off with some state updates to programs and eligibility standards. Here are our amazing speakers for the day. Thank you again. Run of show for our speakers for today. And here we go. So we'll cover a few topics in this session, or in this section here. I want to make sure that I start off with just the general statement here that's going to be really important moving forward. I'm sure a lot of folks on this call have gotten, like I have, text messages from people that or calls, or even just running into people. People are like, oh my gosh, I heard that tax credits are going away for marketplace plans. What are we going to do? How are plans going to be affordable? And I just want to make sure that everybody is, super clear on this call and has effective language for talking with community members moving forward, that tax credits are not going away, right? And as Ariana and as Claire and Stacy mentioned in their presentations earlier today, we're not even sure what they're going to look like at the end of the year. So the important thing is the second section that's on this front slide here, which is people should still apply for marketplace health insurance during the open enrollment period. They should estimate their incomes as accurately as possible, and they should see what their options are, because that's the only way that they're going to know, like whether or not they might be able to afford a plan for the coming year. So that top of line or top of mind, top line there. And so through the rest of these slides, we'll review new healthcare laws in Texas. We did get a request to do a really brief overview also. So we'll do a super brief overview of Medicare, especially with relation to Medicare savings programs, which are still available also. Those did not go away in spite of some recent laws that passed that do change a little bit about Medicare savings programs. I'll also really briefly overview some state programs that do have a couple of changes connected to them. Brief slide on junk health insurance. We'll probably see a lot of people getting more interested in limited benefits plans and whatnot moving forward, how to talk to people about those. And then last thing is just some resources for assisters throughout the upcoming enrollment period and beyond also. So let me get started. And like a lot of people, I think today, our presenters, I'm not going to be able to go through all these slides thoroughly. So what I'm going to do is just cover as much as I can in the next 14 minutes. And then these slides will be available to folks after the conference. And you can always reach out to me and let me know if you want to do another quick review or a training with your staff moving forward, or some technical assistance with a case or anything like that. So we've already covered this today, but just in case anyone is showing up for the first time, everybody in this call knows what Medicaid is. Most people know the Children's Health Insurance Program is another health program, but for families that have a little bit more income than what makes them eligible for Medicaid. And then HR 1 is how I'm going to describe, or how I'm going to talk about the law that the president signed on the 4th of July this year that does make some really big changes to Medicaid, to marketplace health insurance, and to other, I mean, lots of other programs like energy programs, tax programs, and whatnot. But we're not going to focus on those in this call. We're going to focus on the healthcare aspects of those. And Amber O'Connor is going to focus on some of the food policy changes and how they affect people across the state of Texas. So in this slide here, I'm not going to click on them, but there are two documents. This top one is a spreadsheet, and the bottom one is a timeline. And both of those take users to explanations of a lot of different pieces of policy, executive actions, some memos that some of our federal offices have put out over the course of the last 6 to 9 months, and just list them out there very clearly so that folks can see what has happened recently. And then today we're going to talk about the effects of some of those things. But those are there in case anybody wants to dig in and see like the long list of different things that have happened, different policy changes that are going to affect the ways that Texans use health programs and food security programs. So those are there. There are some really important laws that affect healthcare programs in Texas that are just rolling over from past years that I just want to talk about real briefly. One, you can see here it says rollover 12 months of continuous coverage. That's for people who are enrolled in Medicaid and CHIP in Texas, right? So unless somebody reports a life change on their application on yourtexasbenefits.com or a paper application, then children across the state of Texas should have 12 months of eligibility for Medicaid and for CHIP. Sometimes, like technical things happen with computer systems, or an application for one program will accidentally affect an application for another program. And if children are losing their eligibility or losing their Medicaid in those 12 months, it's important to be able to say to parents or to family households like maybe that's not accurate. Let's call the Health and Human Services Commission to see if we can get that reinstated, right? So just to kind of put it on the table, 12 months of continuous coverage is still the standard. No changes to that from the federal government. Also 12 months of postpartum Medicaid, still standard. So when babies are born to moms in hospitals, they should be automatically covered in Medicaid if their mother, if the birthing parent is on Medicaid also during that childbirthing process. And there is a new law that passed this year to make sure that if hospitals or Medicaid insurance companies or families themselves aren't totally aware of it, that when a newborn is born in a hospital, as soon as that newborn needs medical care, the hospital should bill Medicaid under the mother's Medicaid ID number if the mother is on Medicaid, right? And that doesn't always happen. There's a lot going on in hospitals when people are giving birth, right? And so it's important to just remember that newborns should be billed under mother's Medicaid ID numbers until the newborn has their own Medicaid ID number. So that's important for sisters to know, because if people come into your office and they're like, I'm on Medicaid, I don't know why I'm getting these bills for my newborn's health care. Maybe they had to stay overnight or something, and those bills can be really big. But so this law that just passed this year makes it so that insurance companies and the agency itself, the Health and Human Services Commission, have to make sure that notices go out that people that the hospital will bill Medicaid under the mother's ID number for newborns until the newborn has their own Medicaid ID number. So that's a good step that we saw this year in the Texas legislature, and something that a sister should know, again, in case parents come into your offices and are wondering, why they're getting this notice, or what to do if they do get a bill in the hospital. And then also, I just wanted to mention, for CHIP perinatal, hospitals should this has been ongoing for maybe a couple of years, but hospitals should be filling out Form 3038 to get newborns on CHIP perinatal. To get newborns on Medicaid if their mothers were on CHIP perinatal, right? So those kiddos do not qualify for automatic enrollment into Medicaid because their mothers were not on Medicaid. So hospitals should be filling out that form to make sure that those kids do get covered under Medicaid. And then also a law passed this year in the legislative session that will require Medicaid to cover lactation consultant services, which is new and really fantastic to make sure that moms have all the supports that they need to effectively, to provide breastfeeding to their children after they give birth. So that's a billable Medicaid service right now. Or sorry, not right now, but it's in the works, right? So that law passed, and the Health and Human Services Commission and lactation consultants around the state are really excited about that change, which will be available soon. Let's see here. Other new laws that passed in the legislative session, I'm going to go through these really quickly. Medicaid and CHIP will cover the full cost of baby helmets for children with some cranial remolding orthosis. That's like when they have a flat part of their head, right? So they have to wear the helmet to help get their head round. So Medicaid and CHIP will cover the full cost of those baby helmets. Also, insurers must cover telemedicine medical services, dentistry dental services, or other types of telehealth services if people are temporarily outside of the state of Texas. Before, people could get denied for coverage for those things, for that type of telemedicine. But now insurance companies will have to cover that. And that'll be for health plans that are issued or renewed after January of this year. So that includes the marketplace plans moving forward. And then also, this is like a kind of back end thing, but some expedited credentialing did pass also for federally qualified health centers, which just means that it's easier for doctors to get authorized to accept Medicaid to accept Medicaid patients when they're working at federally qualified health centers. So that just makes more doctors available to people. It makes it, wait times get shorter, and it's just a good kind of like structural thing for our healthcare system. So really, really happy about that one. And then a couple of other things also, there are caps now on the amount of money that people will pay if they are uninsured when they're paying for hospital services. So the numbers are all listed on this slide. Again, we can do a deeper dive if we want to, but because we will see more uninsured people in the state moving forward because of some of these changes to healthcare policies, this is an important law that will affect people moving forward in Texas. So if they're paying self-pay for services rendered at a hospital, for a surgery, for an emergency room visit or something, then there are caps now on those cash pay prices. So when people are paying self-pay, not if their insurance companies are paying. So this is for uninsured folks. And then also, higher education institutions have to meet state regulations moving forward for student health plans. So before, student health plans could deny folks coverage based on pre-existing conditions, and they're not going to be able to do that moving forward for over 6 months, right? So the existence of a pre-existing condition time frame shows us all in this call that these are not actual health insurance plans, right? Health insurance plans are qualified. They have to cover pre-existing conditions after the Affordable Care Act passed in 2010. So student health plans are not qualified health plans, but they can be good, healthcare options for some students. And this law makes it such that there's a 6-month cap now on the prohibition or on the ability for health insurance companies to not cover people's medical needs because they had pre-existing conditions. So remember also, though, that student health plans are not health insurance. And so if somebody is at a school and they are offered a student health plan, they can still enroll in a marketplace health plan if it's affordable for them and if they're otherwise eligible, like they don't have an employer offer or something. But the student health plan offer does not prevent them from getting tax credits to purchase a qualified plan on the health insurance marketplace. Okay, so there's those ones. And then a couple more. We have some employer coverage change standards for newborns also. Previously, employer coverage health insurance plans. So, you know, if people had, like, if they work for a big company like Dell or University of Texas or something, those plans could end the special enrollment period for newborns to get on their parents' plans after 30 days. And that is no longer the case. They will have to offer at least 60-day enrollment windows when newborns are born to people on those plans. So that's really important because employer coverage is still the main way that, that people get health insurance across the state and across the country. So that's a big change for people in Texas. And then last thing I just wanted to celebrate here was that the legislature did extend funding for the Medicaid maternal opioid care program, which is only available to folks in Houston, but a really important program to try and improve maternal health in Texas. And there is a link to that program referred here in case any of sisters on the call are in the Houston area. Okay. And now I realize I'm going to have to really hop through some of these slides. So this is a slide about how the Social Security Administration helps fund healthcare programs. If people are on Social Security disability insurance for 2 years, they become eligible for Medicaid. If people get supplemental security income, Social Security disability insurance for 2 years, Medicare. If people are on supplemental security income for any amount of time, they become immediately eligible for Medicaid. There are a couple of slides in here that show how Medicare and Medicaid connect together for people who are dually eligible for both of those programs. I won't be able to get into those today, but they are here. And then Shelby mentioned in her presentation how people who are certain types of immigrants, right? Immigrants who are lawfully present in the country but are not green card holders, they're not in the country under the Compact of Free Associations or COFA immigrants, and they are not, third category, Cuban or Haitian entrants. Those folks are no longer eligible to sign up for Medicare. And then those who are on Medicare will no longer be eligible for Medicare after January 4th of 2027. So just a year and some months from now. So that's on this slide as well. Here's a little bit about the different parts of Medicare. I realize for the person who requested that I do this overview, I've overspoken my time and we'll have to sail through these, but this is an important slide because it does have a link to the local area agencies on aging. These are the organizations that we can connect people with when they're becoming eligible for Medicare or when the Medicare enrollment period is coming around, which it does from October 15th to December 7th every year. And that's when people can make changes to their Medicare plans. So this link here to the local area agencies on aging across Texas, really important for our sisters to have. And really also really important for you to just like get to know the benefits counselors there. You can always give them a call if you have their phone numbers, you know, and like ask them what's new in Medicare. And so importantly, before I stop here in the next couple of minutes, I just want to make sure that we're all clear that Medicare savings programs still exist. This is Medicaid funding that helps people who are on Medicare pay for their co-pays, their monthly Medicare premiums for Part B, and also for deductibles and out-of-pocket deductibles on Medicare. So Medicare savings programs are available through your Texas benefits or through the paper application that people can fill in. But if you're helping people apply on yourtexasbenefits.com, it's this purple category here for Medicare savings programs for people who are over 65 or otherwise on Medicare and might qualify because of their incomes, because of their low incomes, for Medicaid to help them pay for the monthly premiums for Medicare Part B and or Part D for medication copays. And then these are just some descriptors of different types of Medicare savings programs. Some of them will cover more, some of them will cover less, depending on how much income somebody has. These slides are all about dual eligibility, like I mentioned, people who are eligible for both Medicaid and Medicare. And now I'll just again, read through really quickly some important things about Medicaid and CHIP here in Texas, CHIP, the Children's Health Insurance Program. There's a lot in the news right now about work requirements for people who are on Medicaid. Amber's going to talk later about work requirements for people who are on SNAP food stamps. But in Texas, we have never had Medicaid for adults who just because they have low incomes. Lots of other states do. So those work requirements that HR 1 put together for people who are on Medicaid were for those adult populations that we do not cover in Texas. So kind of like with the advanced premium tax credits, if you hear people saying, "Oh, I'm going to have to meet work requirements, or I'm going to have to prove that I have a job to keep my kids on Medicaid," that's not the case. Although it could be the case if they're trying to keep food stamps. And Amber will talk more about that in a bit here. We do have some changes to retroactive Medicaid coverage coming forward in 2027. We'll talk about that again next year. There are some laws connected to the Children's Health Insurance Program that are still in place in Texas, even though they're not in place in other states. So that's like the annual dollar limit for dental care on the Children's Health Insurance Program. Also, we still have a 90-day waiting period for children who enroll in the Children's Health Insurance Program if they are coming off of an employer coverage plan, right? So that waiting period is still in place. And then we do have also Healthy Texas Women is an amazing program, not health insurance, but does provide access to reproductive care and other kind of family planning care and postpartum services for people who don't have health insurance in Texas. So just wanted to include some slides about those. Healthy Texas Women, still available. And WIC, the supplemental nutrition for women and infants and children, still available in Texas. Here is a slide about different types of junk insurance plans. I will tomorrow morning review a one-pager that we have at Every Texan that does a deeper dive into some of these. I just want to make sure that everybody knows that these types of health insurance plans are going to be available to people, and more people will be looking at them because of changing health insurance laws and perhaps increased expenses connected to health insurance moving forward. So we all just have to be able to talk about them as in a sister community and make sure that people know what a junk insurance plan is, what limited benefits means, what a healthcare sharing organization is, and all of those things are just not qualified health insurance. So they don't offer the same guarantees that actual health insurance plans offer. And then last slide here is just a bunch of links and some different resources for folks on this call. We have a monthly meeting where we talk about enrollment and eligibility issues. We do ongoing trainings at Every Texan. I do office hours every other Thursday. We have the Texas Outreach and Enrollment Digest, which is a newsletter. We also have a survey that folks can fill out anytime if they want to just submit some issues that you're seeing as you're doing enrollment and eligibility applications across the state. That was all a whirlwind. I am going to pause for a second just so we have like a little bit of quiet time before we move on to our Health and Human Services presenters. And I will introduce them here in 1 second. There we go. Okay. So, and like I said, we'll have time for Q&A at the end of this session. So I know I just went through a lot of info, but we will move on to the Health and Human Services Commission, who has really graciously agreed to join us here today to give us sisters a kind of like back end introduction or a back end sort of like overview to some of the application processes and electronic data sources that the Health and Human Services Commission uses when they're doing eligibility and enrollment work on their ends. I've always found that this type of like when you can see what's happening on the other end of an application, really helpful for assisters to be able to explain to community members what's happening with their applications and what those community members can do to keep their coverage or to renew or enroll for the first time. So we have here from the Health and Human Services Commission, Rachel Patton and Summer Stringer from the Access and Eligibility Services Department. So they're going to go through this step-by-step process, and I will be available for slide clicking whenever y'all want to. Hang on, I'll get it. There we go.
Thank you so much, Lynn. I will get us started. My name is Rachel Patton. I am the Associate Commissioner for operations here in Access and Eligibility Services at the Texas Health and Human Services Commission. So we'll go ahead and get started with the discussion around the application process and certification process and our use of electronic data. So a little overview about the area that I manage. In Access and Eligibility Services, or AES, we oversee and support eligibility determinations for both our Texas Works types of assistance and our Medicaid for the elderly and people with disabilities types of assistance. When we talk about our Texas Works types of assistance, this really encompasses the Supplemental Nutrition Assistance Program, or SNAP, the Temporary Assistance for Needy Families Program, or TANF, Healthy Texas Women, or HTW, Medicaid, and the Children's Health Insurance Program, or CHIP. If we go to the next slide. There are various ways that individuals can apply for benefits. The first is, of course, online at yourtexasbenefits.com. The second is in person at any HHSC benefits office or community partner. If you want to locate one of our offices statewide, we have over 200 offices statewide. You can go to yourtexasbenefits.com and there's an office locator there. So you can locate an office by geographic area if you want to take a look at offices in your zip code, city, or county. I know that my colleague Summer Stringer is here, and she'll talk a little bit about that community partner program access as well. In addition to online and in-person applications, individuals can always call us and complete an application using 2-in-1 option 2. That'll connect you to our customer care center staff who can assist with completing an application. And of course, we still accept applications by mail or fax. We do have a combined application here in Texas. And what that means is that the same application can be used to apply for Supplemental Nutrition Assistance Program benefits, Temporary Assistance for Needy Families benefits, and healthcare benefits such as Medicaid or CHIP on the same application. However, there is a simplified application if you are only wishing to apply for health care. If we go to the next slide, I want to talk a little bit about the certification process. So once an individual applies for services, we will collect, looks like we lost there we go. We will collect client information. So we'll collect their resources, or really this is their assets. So this is information like things that they own. So their bank accounts, vehicles, their home, for example, property, things of that nature. We'll also collect information on their financials. So this would be jobs that they are working. Maybe it's gig work and they're driving for Uber or Lyft. Maybe it's, their unearned income, their Social Security or unemployment income. And then we'll also collect information about expenses. This could be anything from medical care to their utilities, the payment for their electricity or water, or childcare expenses. Based on that information, we will determine eligibility. As you all know, the eligibility requirements for programs vary based on the program requirements. So our staff will check the requirements for the requested programs, and we'll apply those asset and income tests as necessary, and then we will make an eligibility determination. Of course, if we don't have the information that we need to make the determination, we will reach out to the applicant to obtain that information. The client will always receive correspondence on the outcome of their case. So they will always receive an eligibility notice, which they can also opt to receive electronically through yourtexasbenefits.com if that should be something they opt to do. And then if they're going to receive benefits such as Supplemental Nutrition Assistance Program or Temporary Assistance to Needy Families, we will issue an electronic benefit card or EBT card so that they can access those food or cash benefits. If we go to the next slide. We do utilize electronic data. So we utilize electronic data to ensure accuracy and eligibility determinations. In addition, this also prevents us from, having to ask for information if we receive an electronic data source and the applicant or recipient states that that is representative, we don't necessarily need additional information like check stubs. So on this screen, you'll see that I have a couple examples of what those electronic data sources look like, but it's things like Social Security Administration, maybe disability payments, employment records. If someone, maybe be working, we can access that information as if it is available electronically. If we go to the next slide. I do want to talk just a bit about our systems, applications, and interfaces. So as you can tell, as you know, we do have the Your Texas Benefits website and the mobile app. But I want to talk a little bit about some of those back-end systems that Lynn alluded to earlier. So if we go to the next slide, you'll see here the yourtexasbenefits.com website and mobile app. This probably looks very familiar to you. If it doesn't, I encourage you to check out the app, the website or the app. These are very useful resources for folks to manage their benefits on their own time and in their own way. If you want to go to the next slide, please. One of the tools that we use internally is our eligibility workload management system. This system is really what we use to manage the work that comes in for our more than 8,000 employees who are responsible for eligibility determinations for our program statewide. This system is a web-based system, and it allows our staff to effectively manage our workload. That includes our lobby workload. I here in Austin can tell you all about what the lobby looks like in Region 11 or in the Valley area. This does serve as a management tool for eligibility efficiencies, and it improves the customer service experience because we're able to provide consistent customer service statewide. And if we can go to the next slide, please. We do use the Texas Integrated Eligibility Redesign System here in Texas. We also refer to the system as tiers. This is really our system of record for eligibility and enrollment for all programs. This is the system that we use that has a rules engine with our eligibility rules that are programmed in. And it determines eligibility for all programs. So it is a combined application. And one important item to note is that it generates applications, renewals, and notices, including a request for information and notice of case actions for those that we serve. We want to go to the next slide, please. All right, I'm going to hand it off to Summer Stringer with the Community Partner Program.
Thanks so much, Rachel. And Summer, we've just got like a couple of minutes left.
No, absolutely. So thank you very much, Rachel, for giving us that step-by-step. Just quickly, kind of wanted to give folks an opportunity to learn more about the Community Partner Program. If we could go ahead and move on to the next slide. So our Community Partner Program with Health and Human Services, we have over 1,600 sites that actually offer application assistance, much like most of you actually on the call today. And with this particular partnership, we go into a voluntary MOU, and that MOU actually offers you an opportunity to have a community partner ID that you can then use to log into the Texas Community Partner website. And then as you're assisting someone in creating a user account or actually assisting them in going through the application process so that we can submit those accurate process-ready applications, it actually affords you the opportunity to pull back some data. We all know how very important data is, and this will hopefully assist you in not having to put tick marks on a piece of paper or even do a little clicker. That MOU is actually valid for 4 years. And also our Community Partner Program provides in-depth training so that folks can assist folks with the yourtexasbenefits.com or even that mobile app. We could move to the next slide. And I know I'm going really fast for our interpreters. I'm sorry. I did want to share with you a little bit related to the types of organizations that actually partner with us. We've got faith-based organizations, health centers, school districts, public libraries, and many more. Next slide, please. Just a little bit about some data here so that you can see kind of the reach of the community partner program. We've actually assisted in over 408,000 activities just simply on yourtexasbenefits.com. And our next slide, please. Naturally, we know that we want to be able to assist folks in managing their benefits and applying for benefits at their own leisure. And we also recognize that applying online is not for everyone. It's not easy for everyone. And while many of our assisters and our community partners are assisting folks in taking away some of that anxiety of applying for benefits online, we know that we still need to assist folks with paper applications. And we absolutely do that. And we offer assistance in actually faxing in those applications. And it's certainly recommended that we identify certain information when we fax that information in, such as a case number, our full name, date of birth, and also a social security number can be written on that submission. Now, I'm not suggesting that the social security number has to be actually written on that submission, but I certainly wanted to share that with you. Thank you very much. And then this particular slide, and of course our slides will definitely be provided, just simply shows some of the case management services that are offered to our community partners or through our community partners. And I also want to mention that while you can go to a local office, you can go through your community partner, you can also go through a national number 211 for option 2 to apply for benefits. If someone would like to go and simply visit with their community partner in lieu of calling 211 option 2, then that is also something that they can certainly do. Here's our contact information if there are any questions related to how you can become a community partner, or if you have any questions about community partners in your area, then we certainly want to allow you to go to those websites and learn more.
Thank you so much, Summer. That was a fantastic overview, and thank you, Rachel, also for giving us a little window there. Amber O'Connor is up next, talking about the Supplemental Nutrition Assistance Program, or food stamps in Texas. And thanks, Katie, for taking over the slides.
Thanks, Lynn. Like Lynn said, I'm the food policy analyst here at Every Texan, and I primarily want to break down issues assisters will face as a result of HR 1. As Lynn mentioned, that's what we are calling that one big, beautiful bill. Next slide. Yep. We're going to follow this agenda, but we're going to go quickly and skip some just to help our time here. So next slide, we're going to skip is what is SNAP. You guys can read that. I feel like most of the sisters know the program incredibly well. And we'll skip this slide too, because we get to the point on the next one. So statistically speaking, SNAP recipients in Texas are members of white working households or have members with disabilities. Next slide. We're going to talk more about these topics in particular today. So the big changes to the SNAP program are who is eligible for SNAP has changed, who is mandated to work has changed, and states now share a portion of both the program administration as well as the program benefit costs. We're going to focus primarily on 1 and 2 because that's what impacts assisters the most. Next slide. So categorical changes. These are the people who no longer categorically qualify for SNAP. So people who experience homelessness, veterans, foster youth, and these classifications of lawfully present immigrants. So they can qualify if they're working, but they're no longer categorically accepted. They would have to have the income requirements, meet the work requirements, all of that. Next slide. Do you want to call out which immigrant groups are still eligible? And that's these green card holders. And if they're subject to the 5-year waiting period, they must wait their 5 years. The Cuban or Haitian entrants, and the COFA nations. Next slide. Oh, thank you. The work requirement exemption is still extended to people with a disability, seniors over 65 and over, and caretakers of children under 14. Next slide. So to get around calling these cuts, the government changed their definition of dependents and expanded who was required to meet the able-bodied adult without dependents work requirements. Dependents are now considered children 13 and under. This means if your child is 14 or over, you're no longer exempt from the work requirements. Neither are seniors 55 to 64, people experiencing homelessness, veterans, or foster youth. Next slide, please. So these are numbers our research and development department pulled about households who have a head of household with one of these categories. The good news is that HHSC has signaled that they will follow the federal guidance that no one will be removed from the program until they are screened. People must be screened before they are removed. And this is where sisters are going to come in as our front line, helping folks to get the necessary materials to stay in the program. And we'll talk more about that in just a moment. Next slide, please. So who stands to lose some of their benefits? Let's put a face on some of these folks. A 62-year-old grandparent who is the custodian of their 15-year-old grandchild and cannot work would lose benefits, as would their grandchild if they cannot work. A working parent with 14, 16, and 18-year-olds in high school would lose benefits if they cannot meet the work requirements. Next slide. So let's explore this a bit more to see how it will impact assisters and how it will impact Texans. So we're going to skip the slide we're currently on because it just reinforces what we just reviewed. So nearly half of the households with exempt members who are exempt from the work requirements, are still at risk of losing benefits when the head of household is not meeting work requirements. So there's about 700,000 households that will either be confused by these new requirements and therefore need your help documenting their situations, or they'll be removed by the program at their next review post-implementation. I'm particularly concerned by those who live in who are exempt, the person is exempt from work requirements, say a 65-year-old or a 13-year-old, but they live in a home where the head of household may not be able to meet their work requirements. And we're going to skip the next 2 slides so we can get to why that is particularly concerning in Texas. So the impact's unique to Texas. This is what I'm talking about. HHSC's internal policy of full family sanctions and Texas Workforce Commission's lack of employment and training slots. So we're going to dive a little deeper into those in the next slides. So the first one is full family sanctions. What is this? This is an internal HHSC policy. It's not a law. If a head of household does not meet their work or employment and training requirements with either their own employment or in a TWC employment and training program, then they will receive a failure to comply letter from HHSC. The household then has 10 business days to provide evidence of good cause or have their entire household's benefits terminated. Next slide. So I'm going to provide some lists and some documents to help you determine what good causes are and to help guide people. We hope that policy A1861 would be retired as a result of the new requirements. HHSC will be able to provide additional guidance as to why those will continue under the new program. And we hope that they will provide additional forms and more policy guidance to help assisters. Next slide. So here's a list of some of the job-related good causes. There are many valid reasons to consider. So please take a look at these. They'll be in the slides that you share. Here are some of the job-related ones. And on the next slide, there are some family-related ones. We're going to go faster because I got my 2-minute warning. Here's some examples with forms. So what evidence counts is up to HHSC. I did include, like I said, the ones that do have forms are included and linked in the slides that you'll get after this. So what are some best practices? Sorry, skip ahead, one more slide. Yeah, some best practices. Best practices would be to provide good cause evidence with their initial application and with each renewal. Provide evidence about what they would need to provide in their interview, and stay in close contact with HHSC to immediately communicate any reduction in their hours or changed circumstances. Next slide. So it will take more than 2 minutes to go through this, but Texas Workforce Commission is pledged to the USDA to find these employment and training slots for people who are mandated to work in the SNAP program. TWC doesn't have enough slots already, and as we just reviewed, there could be hundreds of thousands of people that need those slots in the future. Next slide. What does this mean for you? What does this mean for us sisters? We want you to expect higher call volume as these changes get rolled out, particularly in the light of the rush to implement that will happen. Expect more delays because HHSC and TWC will be having a lot more work too. Expect lots of questions about the work requirements. I'm here, call me. I'll come to those office hours. I'll come to trainings. And the USDA has indicated that the work requirements were effective July 1st, but can't be imposed until the individuals are screened. And we're still waiting on some of those dates. All right, I will skip the next section. It doesn't really directly apply to assisters, but you may get questions as a result of legislation passing on SNAP restrictions. And so these next slides will contain information for you to review about those so that you can answer questions. And here's some links and resources. Thanks, everybody. Sorry for the rush there at the end.
Thanks so much, Amber. Yeah, no, thank you, David, also for that comment, which, yeah, totally. This is not enough time to go over all of this information, but of course you can reach out to our panelists, and we are happy to make sure that we can go through these slides with you more slowly. There's just a lot going on, of course, for next year. And we gotta, yeah, we gotta try to just, get the information out as much as possible. So to that effect, Blake Hudson is here from the Texas Association of Health Plans. Thank you so much, Blake. And he's gonna talk a bit about enhanced advanced premium tax credits and what's at stake in Texas here. So Blake, take it away.
Okay, and you can go to the next slide. This is an overview of the market. We just like to provide this so you sort of see the context of what we're talking about. In the instance of these enhanced premium tax credits, we're talking about the individual market, which is roughly about 12% of all Texans. Next slide. So just sort of step back real quick, and I want you guys to understand there's a lot of sort of concern about this, what's going on. So the government is likely to shut down in the next 12 hours, and it's because of this piece here. Back in 2022, the premium tax credits that were established under Obamacare were enhanced. And basically what that meant was the percentage of your income that you're expected to pay towards your health insurance if you buy coverage, it went down. It went down a lot. So for a lot of people at the lowest income levels, before they get under 100% of the poverty level, it went down to 0 in a lot of cases. And what that meant was a lot more people got coverage. These are some top lines of what we expect will happen. About 1 million Texans more will become uninsured, and a family of 4 on average will pay a couple $1,000s more per year. Uninsured rate's going to go to 20%. And we're talking about small business folks, self-employed folks, early retirees, these kinds of people, gig workers. Next slide. So the worst of this falls on Texas and Florida, and it's because we didn't expand Medicaid. And that's because a lot of the folks that would qualify under Medicaid expansion, they overlap with this with these same folks that can get enhanced premium tax credits or premium tax credits in general. And we pointed this out when we did some recent visits to members of Congress that if members of Congress from Texas don't want to do this, it's sort of a self-inflicted wound. A quarter of all coverage losses come from Texas. Next slide. This is sort of stepping back away from the premium tax credits and just looking at the full price premium. And what you've seen is you've had a really stable market. That's going to go away. Next slide. These are some examples of what you see. And there's a couple different things I want you guys to know that's going to happen here. One is the subsidy cliff comes back. So if you make over 400% of the federal poverty level, so that's for an individual, that's about $60,000. So you make a dollar more. Under the old rules, you lost everything. Under the new rules, there's sort of a gradual decline in the premium tax credits. So that cliff comes back. Also, just the enhanced premium comes back, and we see it really hit some of those lower income figures the hardest. Next slide. These are just examples of what the numbers are for an average family or an average individual. Next slide. Next slide. This is interesting because it hits rural Texas and the Panhandle, South Texas, Deep East Texas the hardest. And it's really because those rural areas just have higher healthcare costs in general, sort of lack economies of scale. So healthcare providers are more scarce and just costs are higher. And the whole concept behind the tax credits is getting your income, getting the cost of coverage to be a certain percent based on your income. So naturally, those areas are hit the hardest. We pointed that out for members of Congress that represented those areas that might be in charge of the budget in DC. Next slide. And this is sort of the slide is just telling a little bit of a story that any savings that a family might have seen from the big beautiful bill in taxes are far outweighed by these loss of tax credits. Next slide. So this breaks it down by income category and sort of what a family would afford is expected to pay more per year based on these income categories. And what I don't have on here is that over 400% of FPL, you see some of the biggest increases because a person may make a dollar more and lose that help entirely. And this is really important. I think this is important for you guys to know. Under the old rules, if you underestimate your income, you had some hold harmless about how much you had to pay back of the tax credits. Now, under new rules created by the Big Beautiful Bill, you have to pay every dollar back. Next slide. This is another example of how much an individual person's premium tax credits could go up. What I want to point on this slide is that there's a calculator linked here in the bottom, and you can go in there and you can put a zip code in and actual dollar amounts, and you can get like if the premium tax credits are extended or if they're not, what the difference would be. Next slide. So this is really big. So before the tax credits, the market was hovering around about 1 million to 1.3 million people covered in this individual market. And that was after the early years of a lot of disruption, a lot of uncertainty around what the rates were. So the tax credits come in and we start seeing an uptick, uptick, uptick every year of people getting covered. That's going to fall apart completely next year. And it's going to keep going down. We expect as an industry that it's going to go back down towards where those numbers were pre-2022. Next slide. And this is important because although we still have a high uninsured rate at around 16%, it's been ticking down a little bit because of these people getting covered in the marketplace. That's going to shoot back up to 1 in 5 people in Texas not having health insurance. Next slide. This is kind of cool. So the other thing that's happened is the market's gotten stable and more people have come into it, is you've had more competition come to the state. Back in 2018, most areas of the state had 1, maybe 2 insurers offering coverage in the individual market. Now, pretty much everybody has 3 or 4. There's very few areas that don't, and the reasons that they don't are kind of unique. And the urban areas are, upwards of 9, maybe even more insurers offering coverage. That's going to start to fall apart as well. We actually lost 1 big insurer in that market this year. Next slide. So this is we use these slides in DC. This is some polling numbers. Everybody loves the enhanced premium tax credits of all political stripes. Next slide. We also had some questions that I don't think I need to answer for this audience about the value of having healthcare coverage. Some people question that, but we answer those here. You can skip this next one and the next couple more. Yeah, you can keep going. The other thing to know, and go back one, the other thing to note here is that there's some real big changes that happen with the Big Beautiful Bill around enrollment. Some of that stuff also took place temporarily in the marketplace integrity rule, and this is getting a little technical. But what I want you guys to know is that the requirements to get your income correct when you apply for coverage are getting a lot more stringent. And some of this is up for debate. And like I said, that repayment rule, the other thing that the Trump administration is doing is they're super tightening up the enrollment periods. So when November 1 hits and that open enrollment starts, it's not going to last as long as it did last year. The special enrollment periods aren't going to last longer either. The last thing I'll say is that as an industry, insurance industry, we are required to send out notices in advance of November 1st of how much your rates are going to go up. Those notices will start to be delivered in October. They'll go out on a rolling basis. So the kinds of people you may have helped get coverage are going to start getting letters with real dollar amounts on them over the next month. I'll stop there. Hope I get you some time back.
Thanks, Blake. Yeah, that was really thorough. I did put in the chat an action alert that sisters or anybody who's watching this right now can share with your community members, with your clients, with your patients to try to convince Congress to help keep health insurance affordable. That's a real simple email alert that anybody can send if they'd like to their representatives. And then there's also lots of other opportunities for constituent advocacy or for patient advocacy too. So let me know if you want to talk about those. Up next is Cole Glosser, who is from the Coalition of Texans with Disabilities, who's going to talk about long-term services and supports that are also at risk in the coming years because of reductions in Medicaid spending in the state. Cole, thank you so much for being here. And also, if anybody if anybody wants to ask questions or anything, please use the Q&A or the chat because we won't have much time for questions after the end of this panel, or sorry, at the end of Cole's presentation. So yeah, Cole, take it away. Thank you.
Thanks so much, Lynn. Hey, y'all. I'm Cole Glosser, and I'm a policy fellow with the Coalition of Texans with Disabilities. And I'll be kind of giving a broad overview of Medicaid long-term services and supports, more so specifically talking about the eligibility and the pathways in which these services are being delivered. So next slide. So what are long-term services and supports? So long-term services and supports, or LTSS for short, are very crucial medical, personal care, and therapeutic services provided to disabled and elderly people through Medicaid. It's important to note that LTSS is usually not provided through private insurance and is only very minimally covered through Medicare. So Medicaid is going to be your largest payer of long-term service and supports. And these can be accessed, these services can be accessed out in the community, as well as in your own home, a family home, or as well as an institutional setting like a nursing facility. And as opposed to acute care where you're dealing with diagnosing and treating of conditions, LTSS is primarily there to assist in building and maintaining disabled or elderly person's functioning. Next slide. So I will next kind of go over how different services are delivered throughout the Medicaid state plan, as well as Medicaid waivers. So for Medicaid state plans, this is basically the broad scope of Medicaid services that are covered in Texas. And this includes both mandatory, which are benefits that every single state is required to cover under federal law. But additionally, there are optional services that the state can choose to cover as well. And it's important to note, especially in terms of the different budget cuts that we're seeing around healthcare, that considering a lot of LTSS is going to be it is an optional service. The state legislature will play a big role in determining if there will be reductions in these optional services in the future. And it's also important to note that with the Medicaid state plan, these are generally covered for all Medicaid eligible individuals who meet criteria. But on top of that, there's also services through Medicaid home and community-based waivers, and this, you can also see this as HCBS oftentimes. And these are tailored towards more narrow or targeted populations within Medicaid, especially when we're dealing with different disabled populations. For instance, there are a couple of waivers that are specifically geared towards individuals with intellectual and developmental disabilities. There's even one where it's specifically geared towards folks who are not only deaf-blind, but also have an additional disability on top of that. And these services are much more expansive and flexible as the rules are waived by the federal government, and this is why they are called waivers. And in this case, what is being waived are the coverage of certain populations as well as the reducing of the income restrictions. But it's important to note with the waivers that states can institute waiting or interest lists due to a limited number of funded slots. This is a very big issue in Texas, where we have very long interest lists that people will sign themselves or a loved one up for, in order to hopefully get their name to the top of the list as quick as possible, but sometimes it can be a matter of several to more years. But in Texas specifically, we have interest lists because eligibility is not determined until you get to the very top of the list. Next slide. Yes, thank you. So just to kind of go over some of the long-term services and supports within the Medicaid state plan. So again, what mandatory or federal benefits, these will not be changed or cannot be changed without a change in federal law. So basically, these will continue to remain as part of the Medicaid state plan. These include things such as nursing facility services or some home health services. But some examples of optional state-specific benefits that Texas chooses to cover, but may or may not reduce or completely eliminate in the future, depending on funding cuts, are services such as physical therapy, occupational therapy, and additionally, we have in Texas something that's called community first choice, which is how many of our personal care services are managed out in the community. And this service is available both through Medicaid managed care as well as the home and community-based services waivers. Next slide. So although I can't get way too in depth into the specifics of each HCBS waiver, I just want to kind of give a brief overview of the different ones that we have in the state in case you might be assisting a family who has a loved one with significant disability who might benefit from expansive services. So the first one is the Community Living Assistance and Support Services, or CLASS waiver. And this is specifically for folks who have related conditions. And what that means is essentially it's a physical or medical condition outside of the intellectual or developmental disability umbrella. So for folks who need personal care services in the community, for instance, based on their physical disability, they might rely on the CLASS waiver. There's additionally the deaf-blind with multiple disabilities waiver, or the DBMD waiver. Again, kind of going back to what I previously said, this is specifically geared towards folks who are deaf-blind and have additional disability. Two waivers that are specific to folks with intellectual and developmental disabilities, or IDD, are the Home and Community-Based Services, or HCS, and the Texas Home Living, or TXHML waivers. And the Medical Dependent Children Program, or the MDCP waiver, is specifically for medically fragile children under the age of 20 who require more intensive services. And then additionally, there is a STAR Plus waiver that is more geared towards elderly, so 65 and up, and folks with physical disabilities and having their personal care needs met. And if you're interested in learning more about the specifics around the waiver, we've included this link from the ARC of Texas as a resource. Next slide. And kind of so this is my last slide, but basically just some more information around the waiver. So again, each waiver has a specific criteria that a unique and small population must meet in order to access its services. And it's important to note that why there is such a high demand for waiver services in the state is because these are more expansive than state plan Medicaid or traditional Medicaid, in that lots of these waivers cover greater services such as home accessibility modifications or specialized therapies, as well as employment support services that are not typically covered through traditional Medicaid. So I will go ahead and stop there and turn it back over to Lynn. Thank you.
Awesome. Thank you so much, Cole. Yeah, those are really important programs for folks around the state. And yeah, our lawmakers are going to have to work really hard to preserve some of those optional services for Medicaid enrollees. So that's kind of like, looking forward or looking ahead to some program changes that we'll see in maybe 2026 to 2027. But just wanted to make sure that folks were aware of those things right now. And like other panelists have mentioned, be able to prepare our community members for some of the things that are to come. And we've got a few minutes here. We've got 5 minutes until the end of this panel. I see one question in the chat from Annette, who asks, oh, wait, I said that I would share my slides again. Let me do that real quick. And let me see if I can do two things at once. Annette says, where can we find information regarding lactation consultant services? And who can bill? I will tell you that in just a second, Annette. Okay, so y'all should be able to see my screen again here. We've got the Texas Women's Healthcare Coalition is working on, the Texas Women's Healthcare Coalition was a big sponsor of the lactation consultant services law that did pass. And like with the other law changes that we've seen from 2025, it does take the Health and Human Services Commission some time to put the different pieces together for those laws to take full effect. So they're in place right now, and the Health and Human Services Commission is getting the paperwork in order and the networks in order for people to be able to bill for those services. And like I mentioned with the baby helmets, Medicaid and CHIP will cover moving forward. Those things we will keep everybody posted in the Texas Outreach and Enrollment Digest, which is linked to in our slides here for today, and in the Get Covered Texas Coalition, which is on the fourth Wednesday of every month at 2 p.m. So feel free to reach out to me to get on either of those lists, or just follow the links that are in our slides here today. And then we'll let everyone know as soon as we do have billing codes and whatnot. And then there will be provider education to do after that also, to make sure that doctors know that those changes are in order. And it looks like we've got a poll lined up here. Katie, do you want me to read those out loud?
Yes, please.
Okay. So here's the poll. 1, I better understand new Texas laws affecting eligibility for healthcare and food programs to better inform people using educational materials. Number 2, I have more knowledge on how to convey health insurance cost increases, provide education on plan selection, and work with qualified health plans in my area. Number 3, I learned about policy changes impacting healthcare programs for people living with disabilities. And that is the end of the poll.
Thank you, Lynn, and apologies again, folks. I know there was a lot of content covered in today's session. I believe that Simona dropped a link, a view link to the slide deck. So please use that as a reference, and we will be sharing out that resource along with others shared during today's presentation after the conference. And Simona is doing our spinning of the wheel right now. Looks like we have our winner, and my apologies if I say your name incorrectly, but our winner is Ricky Severda. Severda. Ricky, if you are here, if you could respond in the chat box or raise your hand just so we can see you. Congratulations. Ooh, someone's excited for Ricky. There's your hand. Amazing. We've got it. We will be following up post-conference with you to make sure that you get that $50 gift card. And with that, that is the end of our third session for the Texas State of Enrollment Conference. Again, we have another 15-minute break before the start of our next session. Our next session begins at 2:30 p.m. And I usually have my nice little document open to read out the description of our next session. But now it's in front of me. It is healthcare options for the uninsured. What is available and who is eligible? So we will see folks back at 2:30 p.m. Thank you so much, everyone. See you soon.